Hari ini dibawa usaha Putra MIC, ada satu majlis untuk melawat pesakit di dalam ward Pediatrik di Hospital Besar Kuala Lumpur. Dan ini adalah satu institut pediatrik yang agak lama dan sebagai satu langkah untuk meningkatkan lagi kemudahan, kerajaan melalui satu inisiatif public financing initiative sedang membangunkan satu kompleks baru, maternal and child and children, women and children's hospital, dengan satu perbelanjaan yang agak besar, dengan jumlah katil 600 katil, dan lepas kemudian itu disiap mungkin di dalam lagi 2 tahun. Lepas itu kita akan pindah sebahagian daripada perkhidmatan yang ada di sini ke konteks baru, dan itu akan memberi ruang dan tempat yang lebih selesa supaya perawatan untuk penyakit-penyakit yang menghidapi budak itu boleh dibuat di dalam satu keadaan yang baik. Dan kita akan gunakan kompleks ini juga selepas menambahkan lagi ruang yang ada. Dan di dalam banyak daripada institut pediatrik di seluruh negara, kita telah melalui kerjasama daripada yayasan sukarelawan telah mewujudkan sekolah di dalam hospital, di mana anak-anak di dalam hospital mendapat peluang untuk menyambungi pendidikan mereka tanpa gangguan dengan guru-guru yang telah diberi secondment untuk kerja di dalam sini daripada Kementerian Pelajaran. So di hospital ini pun kita ada sekolah dalam hospital, dan sedikit demi sedikit kita sedang meluaskan penggunaan supaya saya ingat di dalam ini 2-3 tahun ini saya ingat tambah 10 atau 13 penggunaan di merata-rata tempat di negara kita, supaya anak-anak yang khususnya yang mengidap penyakit kronik yang memerlukan rawatan panjang masa boleh mendapat rawatan tanpa gangguan kepada pendidikan. Okey, ada apa-apa soalan?
September 2016.
2016. It's already about
13%.
huh?
13.
13%
It's ahead of time.
complete now. So by 2016 it should
How many percent?
13. 13.8%.
So by end of 2016 it should be ready. It's going on quite well. I visited it I think about 2 months ago. And so that will give us additional space. This is part, I mean other than that we're also building a car park which is more or less ready, which will give us additional 2,000 base of car park in this hospital. So with these new things and with new roads which run around, GHKL should become less congested, with more free flow of traffic and less congested. Okay?
How many have been approved for this contract from the government?
Right.
The new complex.
The cost of it,
Because
total cost how much? 600 million.
No, it's 800 plus. The last one, 848 million.
848 million. Hospital wanita dan kanak-kanak. 848.
so generally how many skilled hospital that you have to nationwide?
This is a figure. Not exactly. I think it's, if I'm not mistaken, about 13. 13.
Nationwide.
Nationwide.
And how many school teachers?
I'm not sure. Exact number of teachers. You have how many teachers here?
No, 9.
9 teachers.
9 teachers.
So there might be
This
about
hospital.
for each one school. Right. Okay.
That's right. Another question. A man has been confirmed dead with Ebola in Saudi Arabia. So how does this affect our pilgrimage to Hajj in October? Any advisory from the ministry regarding
Well, the way Ebola is spread is by direct contact with body fluids from a person who is having the disease. So the whole thing about preventing Ebola is basic health maintenance. That means avoid contact with people who are sick, and if there is a need to do so, then you must take precautions like wearing gloves, wearing gowns, masks, and all that. A lot of the cases which is spread in Western Africa is because they are not able to follow these principles of health, particularly among those who are in healthcare, these nurses treating patients, doctors treating patients, people are taking care of patients. And the other is in the community, particularly when one dies, how they manage the death. So this is an issue which has to be addressed very seriously, particularly in those countries, so that contact with the infected person can be reduced. And if there is not avoidable, then health precautions have to be maintained very strongly. So our advice will be for all those who are going is to ensure that you avoid contact with people who are sick. And if it's unavoidable, you must take precautions to ensure that you don't come into contact with bodily fluids. And the people in Saudi, they should ensure that these people are managed in a way that they reduce the likelihood of contact amongst normal people, so that this doesn't spread on. Okay? So it's not airborne, like you don't sit in a place and you talk with this. It's also not spread by insect bites from a person. Okay? Right.